Hi, we're going to have just a short video talking about venous return, or the way that we get blood back to the heart after it's gone out to the body. Now remember, the heart is responsible for pumping that blood out to the body, but then it has to return back to the heart to be taken out to receive oxygen and to get rid of that CO2 in the lungs. So we have some mechanisms that are used for that because we don't have those pumping stations anywhere else, remember. Okay, so let's look at these different ways that we do get that blood back to the heart. And we'll talk first about the respiratory pump. I'm going to give you just a brief overview of these, and then in the next couple of slides show you some illustrations of this. So the respiratory pump is actually a pumping action that occurs because of pressure changes. And we'll elaborate a little bit more on that, but it works sort of like moving liquid through a straw. As you suck on the straw, you're actually creating pressure changes, and that in turn causes the liquid to rise. So we'll talk about the respiratory pump. Now remember, pump is not something that's actually pumping something out like the heart, but it's a pumping or moving action because of pressure changes that occur throughout the body. The second mechanism is the muscular pump. Now remember, as you see here in this diagram, you have muscles surrounding these vessels, and these vessels that you're seeing here, of course, are veins. And this works similar to the way a tube of toothpaste works. If you squeeze that tube of toothpaste, then the toothpaste is going to move in one direction or the other, or both. So that allows that blood to be pushed along those vessels. Now, normally if you grab something and you squeeze it in the middle, like grabbing that tube of toothpaste and squeezing it in the middle, that toothpaste is going to go out the open end, but some will also be pushed downward toward the bottom. Well, the same thing happens with your veins when the muscles squeeze, but we have built-in valves that are located within the veins that prevent backflow. The next picture we look at will show that a little bit better as well. And then we have vasoconstriction of veins. Now, a lot of times you'll see that the three mechanisms that are listed are your respiratory pump, your muscular pump, and then the valves will be listed as the third. But in reality, there are four mechanisms, because that vasoconstriction of veins also is going to, as the vasoconstriction occurs, it forces the fluid, the blood within those veins, to move along the passageway. All right, so let's look at these illustrations. Now here, of course, you have the muscles surrounding the vein, and you can see that the muscles have contracted. So when those muscles contract, it's squeezing on the vein. Now when the vein is squeezed, the blood is going to move in both directions. But of course, if the heart is up above this vessel, we don't want that blood to be pushed back downward. We don't want it to be able to go back down. It will actually be pushed downward a little bit, but as that blood is pushed down, it comes in contact with these valves. Now these valves are oriented to where when something pushes backward against them, it pushes them closed instead of open. So you can see on this upper valve here, as the blood flows through, it forces the valve to open more. But if the valve is like this and the blood is coming back down, then when the blood hits the flaps of the valve, it forces it closed to prevent the blood from going back down away from the heart. All right, the next thing I want to briefly just talk about is that respiratory pump. And I know there's a lot of words on here. I just found that it sort of explains things pretty well, but we do want to talk about it just a bit. So when you take a breath, okay, you're expanding your thoracic cavity. Okay, when you inhale and bring air in, you're expanding the thoracic cavity, so your pressure is going to decrease in that cavity. Okay. When you exhale, that cavity becomes smaller and you increase the pressure. All right, now that's happening because of let's try that again. That happens because of contraction of the diaphragm. Remember from 201, the diaphragm is that muscle that separates the thoracic from the abdominal cavity. So when that diaphragm contracts, what's going to happen? It's going to pull downward, okay, caudally, as you see here. Remember, caudal is tail. So it's going to pull in a downward fashion when it contracts. So that's going to increase the thoracic cavity capacity, and air rushes in. All right, now it's pushing downward, so that's increasing the pressure in the lower cavity. It's increasing the pressure in the abdominal cavity. Now, as these pressures are changing, you exhale, then the pressure decreases in the abdominal cavity, increases in the thoracic cavity, and those changes pull the blood up in the veins toward the heart, similar to the way that liquid moves through a straw when you suck on it. All right, so I know that's a pretty basic explanation of these mechanisms, but it is pretty easy to understand when you think about we're simply moving things along due to these mechanical aspects. One thing I do want to bring up are varicose veins. I'm not sure that's been covered, but just in case. Varicose veins happen when the valves blow out. So those valves are no longer able to prevent blood from flowing back, and you have a pooling into the small capillaries and sometimes out into the tissues as well. All right, I told you this one would be short. That's all I've got for you.